When you're in an area like healthcare in India, where you're developing drugs and medicines for patients, and you realize that not too many patients can afford the kind of drugs that we're developing, I realized that I've got to do something about it. In fact, my raison d'etre for getting into biopharmaceuticals was to provide affordable access to life-saving drugs which were so beyond the reach of even reasonably affluent people. And that's why I basically said to myself that, to me, a blockbuster drug is not about $1 billion. It's about 1 billion patients. And that, to me, has been my mantra of developing drugs that provide affordable access. And I've basically focused on cancer and diabetes. And the reason, of course, I focused on cancer was because cancer is one of the disease areas which is so very expensive. And many people just die because they can't afford the kind of drugs you need to cure cancers. And that, to me, was huge injustice. And I felt that was extremely unethical. And I felt that was something that I had to correct. So that was my first start of getting into this area. But once I got into this area, I realized that even if I provided affordable access to life-saving drugs, there was still a large number of patients who couldn't even afford that. And that sort of, invoked a compassionate sense in me, where I felt that I've got to create a compassionate space for people who just can't afford any form of healthcare. And that's why I went about looking at cancer in such a significant way, because I just felt that cancer care is very expensive. So I created a Mazumdar-Shaw Cancer Center in partnership with Dr. Devi Shetty, who I also felt was that kind of a doctor who had this compassionate care approach in everything he did. And to me, it was a meeting of minds. I wanted to make a difference in cancer care with compassion. He had already done this in cardiac care. And therefore, I felt that it was a nice synergistic partnership.